You're listening to the Westminster Canterbury Tales podcast, creating community to foster joy and well-being. Thanks for listening.
Wow, it's a great day for our podcast, Halloween, and here we are talking about my favorite subject.
Is
Alex,
it cannabis?
Yes, Alex, tell us what we're going to be doing today.
So today we're doing it
scaring people.
Hopefully not too scary. We're going to bring lots of treats and good information, maybe a couple of tricks.
Do you have samples, which is something that we always get asked?
You came right out of the gate with the most popular question. We don't have samples here today in the podcast room. However, we do sell hemp products through Cannability Consulting as a part of your consultation package, if that's something that you are interested in and need, or we can help connect you with high quality products that you may be interested in or others have recommended to you before.
Well, since we're calling this podcast AMA, Ask Me Anything, I guess I could start out with that really hard question.
It was a great question, and I'm sure a lot of listeners are wondering or maybe have already asked it before, so glad we got that one covered. And so today we're going to be having folks call in from either 757-77-CANNA, which is 757-7722-662, or they've already emailed us their questions through info@cannability.com or sent us a message on social media. So we're going to be answering some of those most popular questions, which may generate more. So we encourage anyone who's listening today to feel free to reach out to us so we can have those questions added to our next AMA episode. Tom wrote into info@Cannability asking, are the cannabinoids we get from hemp the same as those from marijuana? This is a perfect question for us to address in one of our first episodes because it's one of the biggest questions that we tackle through the consultation process, whether someone is going to receive the benefits of cannabinoids through hemp or through marijuana. So let's talk about the differences. Hemp and marijuana are legally distinct variations of the cannabis sativa plant, with their sole primary difference being the concentration of THC in each. So hemp contains less than 0.3% of delta-9 THC, also known as tetrahydrocannabinol, by dry weight, whereas marijuana can contain more than that. So hemp is available through the 2018 Farm Bill. It's what you often see over the counter, quote unquote, online and in stores that are available for access without a medical certification for treatment. Whereas medical marijuana, especially in the case of Virginia, in order to gain access to medical marijuana or medical cannabis, as we prefer to call it, you have to have a written certification from a practitioner stating that you have a medical condition that qualifies you to benefit from it. There's also the ability to home grow, of course, if that's something that someone is interested and capable of. But to answer Tom's original question, hemp and marijuana both contain hundreds of different components, much of which we like to call cannabinoids. THC and CBD are the two most common, and the distinction between hemp and marijuana is all about that amount or concentration of the THC component of the plant. But both can contain other cannabinoids like CBN, CBG, and more.
So Alex, as I was preparing for our time together today, I was reading about our founding fathers.
Yeah.
Way back in the 1800s, did you know George Washington attempted to grow hemp at Mount Vernon so he could have supplies for the troops? And then Thomas Jefferson, being the creative guy he was, designed a hemp rake to break down the strong hemp stalks and fibers. So what's going on with right now in the environment that we're in? Because society finds itself in a real confusing state of legal, social, justice, and regulatory issues. And I know that we've already had a question about regulatory issues. So tell me a little bit about what your thoughts are.
So to follow up what you said about George Washington, that is correct. In fact, while we're talking about history, the Declaration of Independence was written on hemp paper. And farmers in the state of Virginia were required up until a certain point to grow hemp because it can be used for paper, for industry. There is such a thing called hempcrete. There's so many things that this wonderful plant can do, both inside us and outside in our community. As far as where we stand in the United States with hemp and cannabis today, It, of course, varies state by state. And so at the national level and federal level, cannabis is still considered a Schedule I substance under the Controlled Substances Act, meaning that it is believed to not have any potential for medical use and has a high potential for abuse. This has been disproven for literal decades now, and almost every state in the country has some form of medical cannabis program, meaning it could start just simply as that they permit CBD all the way up to allowing both adult and medical cannabis use. So it varies from place to place, and we're a little bit all over the place, but the general public opinion and general consensus is in support for many, many reasons that I'm sure we'll continue to dive into throughout this podcast.
So we've got our first question that came in from information@cannability.com, which I'm going to attempt to answer.
Yes.
And you can help me out there, Alex.
Okay.
So the question is, can public safety workers or federal employees safely use cannabis to improve their overall health or to help their job-related conditions like anxiety or PTSD? And this came from a curious firefighter, no name attached. So most individuals can safely use cannabis, but the potential impact on their employment status has to be understood. So federal employees working in law enforcement and national security, they're protecting the lives of others or property, or public health and safety, or those in a high degree of public trust are really subject to mandatory drug testing.
Sadly.
So yeah, and that is very unfortunate because these individuals have some of the same opportunities for improving their life that others do. So it is very unfortunate. State laws for non-federal first responders such as firefighter and police officers vary. So could somebody lose their job? Like a firefighter could lose their job because, let's say, they're taking THC or cannabis for managing their pain.
You know, they can. And that's why when I get this question during a consult or even before a consult, I really encourage folks to understand what are they allowed to do within their state and within their organization. So while there are isolate products that can be proven to not contain THC in them, of course, there's always a risk for a positive drug screen. And so it's important to hear the word that I just said of reduce, of that part of our consultation always emphasizes safety, safety, safety. It doesn't just have to be the safety of your own well-being, but the safety of your occupation and things like that. So understanding, what your boundaries are within your role and learning more, because there are policies that are changing. Attitudes and perceptions and organizational policies continue to shift and change all the time. And so you never know what your organization may be allowing as medical programs grow and the evidence and the science about this plant continues to grow as well.
So if I have a medical marijuana card and I go to work and I give it to my HR director, they could still, if I'm a firefighter, could terminate me because I could be under the influence at work?
Potentially. And that could go for any public safety federal employee or even at an organization's discretion. There are some political action and things like that are working towards supporting folks who truly have that medical cannabis card, have that need, and the benefits outweigh the risks and, all of those things. But it is quite possible, unfortunately. And it is one of the many things that is slowly making a turn in this nation, but we still have a little bit of a ways to go in being consistent. Hi, you're live with Cannability Consulting.
And ask me anything. What's your question today?
Hi, thanks for taking my call. I was talking to a friend of mine about cannabis therapy, and she mentioned something about an entourage effect. I tried Googling it, but it's a little confusing. Can you explain it to me?
Sure. That's a really great question. So
it's a good thing.
The entourage effect is a good thing, by the way. I hope your friend said that. And that is really the ultimate goal of cannabis care. So there are hundreds of compounds in this plant, and on their own, they're not very active, or they might have a little bit of things going on. What we really do is we want to optimize the relationship between a couple of other terms that might be new to you, such as the cannabinoids, the terpenes, the flavonoids, and things of that nature to design what's called the entourage effect. And that's where we're really getting to a balance or a homeostasis, and we're able to really magnify the therapeutic benefits on our body, our mind, our emotional state. We're able to minimize side effects or adverse effects, and we're able to increase the effectiveness on cannabis with your target conditions. So I often tell folks that they may have seen a benefit from sort of blindly using CBD or blindly using THC, but when we really start to look for a product that has terpenes, which is like the essential oils of the plant that most align with your targeted goal or symptom, you could see even more positive effects, and perhaps even for a longer duration. Did that answer the question or create more questions?
No, that answered my question. I do have a follow-up question.
Sure.
Does it matter how you are taking that? You're doing your therapy. Is it like topical or oral, or does that effect happen no matter how you take it, or in specific ways?
That's an awesome follow-up question. So
you're a naive one, aren't you? We're glad you called.
Let's get you signed up for a consult and we can definitely talk more. So the route of administration certainly plays a tremendous part in how it makes you feel, how quickly the product can make you feel, and for how long. Every route of administration has its pros and cons. And oftentimes, depending on what's going on, folks may use more than one approach. So for example, if they're having difficulty sleeping and have chronic pain from arthritis, they could benefit from ingesting things to get to that homeostasis that we talked about earlier on a routine basis. But say there's a particularly painful day, or had a really great exercise class and experiencing some extra soreness, a topical product could help with breakthrough pain that we're not seeing through other ways. So certain routes of administration can be more helpful for a particular reason or another. And that's another thing that we help people sort of discern and identify is the route, the amount, and the composition of the product that you'll be taking to fit your needs.
Awesome. That makes perfect sense.
Thank you.
Thank you for calling.
Let
Let us know how that effect goes when you discover cannabis in your life.
Absolutely. I'm excited about it. Thank you.
Thank you.
So we have another question that just came in to info@cannability.com. And this question is a little bit about how it all kind of works. So we're talking about, cannabis, but what kind of products are we talking about? Like, do you go to the store and buy them? The question is, the person says, I see them in the gas station. I could find them in a local grocery store. Actually, this week I went into where I get my hair done, and there was products on the shelf. And I asked the individual, tell me about those. And the person said, I don't know anything about them. We're just selling them. So the question is, how do you really manage through this sea of products?
So trying to discern products, I always tell folks that just because it's for sale does not mean that it is safe. And you are absolutely correct. There is a sea of things out there in all sorts of shops, or even online. It's just about everywhere you turn, and it really can be hard to determine where to go or what happens next. And so it's really important to make sure that, I'd say starting off, that every product that you even consider has what's called a third-party lab test or a certificate of analysis that shows what is in that product, what should not be in that product, at what levels. So earlier, when that curious firefighter asked about the public safety workers being able to use cannabis, and I had mentioned isolate products. So an isolate means that you're extracting one particular thing and avoiding the rest. And so something that's labeled as an isolate product, if you were to look at that test, you would be able to validate whether or not that is true. But that test needs to match up with the product that you have on hand, and there are extensive labeling requirements. It's always great to encourage childproof packaging, and we also do have solutions here at Cannability for that. If you do have something that's not childproof, we do have the ability to help secure that in a safe way. Are you enjoying this podcast so far? Are you interested in learning more about cannabis? Check us out on cannability.com or send us a message at info@cannability.com to learn more about how Cannability can help empower you to achieve your health and wellness goals through cannabinoid therapeutics.
So, Alex, I think it's fun because people will say when we're out consulting, where are y'all from? And we say we're from Westminster, Canterbury on Chesapeake Bay, Life Plan community. And they're like, how did y'all get into this? And y'all like to say, how did we get in the weeds? So with that, we're here to talk a little bit about how did we actually get started and how did this happen and what is the interest? I think what we have found here that so many of our residents are so interested in finding out more about what's good for them because they're already using the products, but they don't know if they're using the right thing. They're spending lots of money and then they're not sure if it's really having the right effect. And so that's kind of how we got started. So we've been doing this for about 4 months, 5 months?
Well, we've been officially established as Cannability Consulting now for about 4 months going on 5, but we've been quietly doing this at Westminster Canterbury on Chesapeake Bay. Well, I shouldn't say quietly. We've been doing this at Westminster Canterbury on Chesapeake Bay for the past 3 to 4 years, and in working through that, really identified a need to open up what we have to offer and what we can assist people beyond the walls of our wonderful community. And I agree that question comes up quite a bit about Westminster Canterbury on Chesapeake Bay. What do you mean? How? And I think that's a great question for me to ask you. When I came to you and asked about pursuing my doctorate of nursing practice and shared with you what I might be interested in, initially right from the moment we started, everyone was very supportive. But can you talk a little bit about how that support really grew and we identified the need to establish what we're doing now?
Well, as you started out really kind of trying to gather data and who would be interested and who had knowledge, it was so overwhelming in terms of the support, wanting to know more, wanting to make good decisions. But also we have healthcare on our campus, and to really see the benefits of using cannabis in a healthcare setting has been so tremendous that it would be sin not to look at this as an alternative. One example recently related to individuals who might have dementia and sundowning in the evening and behaviors that go along with that are hard for staff to really anticipate, whereas we could get ahead of that with looking at when an individual might have higher anxiety in the evening and then might have some more aggressive or assertive behaviors. And how do we go about dealing with that before it gets to that point? What a benefit that is. I know my dad had dementia, and sometimes he would do things that he did in his past that were not anything that I'd ever seen before. And if we were out in the public, I was, a little embarrassed. And one of the things he would do is spit, like, wow. So that was something. He was in World War II, and that came back to him to spit. And so I couldn't get care providers that wanted to come in the home. So I had to try to address that for his quality of life. And this was not anything I ever considered because I knew nothing about cannabis.
Wonderful. We're going to come back to that. It sounds like we might have another caller, so we're going to circle back to that.
Absolutely.
Hello, this is Cannability Consulting with Ask Me Anything.
Hello, hi.
Hi.
Just calling in with a question for you.
Sure, thank you. What's your question?
So my question is about the actual prescription of medical cannabis. My question is are there board certified doctors that prescribe medical cannabis in the state of Virginia?
So the answer is there are providers, whether it's a medical doctor, physician's assistant, nurse practitioner, or doctor of osteopathy, that can certify that someone has a qualifying condition that could benefit from the use of medical cannabis at one of our dispensaries here in the state of Virginia. What most practitioners do not do, though, is they do not write a prescription for what to take or what to request or what to purchase once you arrive to the dispensary. So a medical practitioner can help you get there, and what Cannability Consulting can help do is help figure out what's next before you go in trying to select a product or a regime that aligns with your goals and needs at an amount that will minimize your chance for adverse reactions or side effects.
Gotcha.
Did that answer the question?
Yeah. Is there a list of those doctors in our area, the Hampton Roads area?
There is. So on NORML's website, there is a list of providers as well as the Virginia Board of Pharmacy. And I have to, of course, add in that with Cannability Consulting, if through a consult we identify that going the medical cannabis route as opposed to perhaps the hemp-derived route of products that you can purchase without that certification or consume without that certification, we can assist you in referring you to a provider that can help, or that's a service that we offer within our walls of Cannability.
So you said you can even assist in recommending a medical doctor that would prescribe it?
That would give you the certification to go to the dispensary, yes.
Gotcha. My question relates also to wondering if Social Security Administration recognizes medical cannabis as being a actual medicine.
Sure.
Because I'm in the process of applying for disability, so I wonder how that might factor in, if they would even recognize it, a medically prescribed medication here in the state of Virginia.
This is a little bit tricky. Cannabis is still federally recognized as a prohibited substance that's classified as a Schedule I drug under the Controlled Substances Act, meaning that from a federal perspective, cannabis does not have medical uses. However, almost every state has some sort of medical cannabis program, and as long as the use is not impacting your ability to work or is not related to an addiction, in theory, it can be used as a medical treatment. However, the only way to know for certain how this could impact you is, of course, consulting with your legal counsel.
Great. So once again, that list of doctors can be found on what website?
The Virginia Board of Pharmacy. I forgot to mention one thing, that there was a recent change where previously a provider had to register to be on that list, and only certain practitioners were able to certify patients for a medical cannabis card. But now any of the providers that I mentioned earlier, those types, they are eligible and able to do so. It's just whether or not they have the knowledge and the skills and the willingness or the organizational support to make that recommendation. So while that list may be there, any provider in the state of Virginia, I should clarify, is that the state that you're calling from, is Virginia?
Yes.
Okay. Yep. Any practitioner is eligible, but I think finding one who is willing and comfortable can be a different situation. So thank you.
Thank you. Have a great day.
You too.
Alex, I know one of the things that Cannability Consulting is really focused on is educating physicians, because I feel bad for this individual because he's trying to go through a disability review. He doesn't want to go right into surgery. What are the alternatives? And I think he might find resistance when he starts talking to his pain physician, which then will lead him in more of confusion around what can I do short of surgery. So I know you've been going out to talk to medical providers. What are you finding?
So what we're finding over and over again is healthcare providers in general want to learn more. They want to understand. They're getting patients who are asking questions, or they're interested in making those recommendations because they see the benefit for one reason or another. And what we're finding is just this big sea, or this big gap, if you will, of the interest and the willingness to educate their patients and to be able to give a response, but not knowing where to begin in how to do that, or what is sound guidance. The first oath that a provider takes is do no harm, and they want to make sure that they're giving that sound advice. And so that's something that we're excited to continue to expand our offerings in, really tailoring our education to the specialty practice in which that provider or that group is working. While we are very familiar with long-term care and older adults, the general principles of cannabis can apply to primary care, to pain management, and other disciplines. And so it's been great to focus that education, say, for nurses at the bedside of a assisted living who need to actually handle the product and administer it, versus a primary care provider who's getting the question, just like we just had from that caller, and how do we respond to those things.
So I think the important thing, and one thing that we do very well, is to help educate the individual before they go talk to their provider, to really, so that when they go to talk to their provider, they have the information already available. This is what I know about the product. Research has shown this. I would like to just sit down and discuss with you the possibility of using an appropriate product for my certain situation. I think if you just go in and say, hey, doc, I really like to start on some cannabis. What do you think? You're going to get one response. Whereas if you go there and you're educated, then you can really help direct the conversation with the physician.
You're exactly right. It's a very different, when you're asking just a general, hey, how about cannabis for me? It's a little bit more than saying just yes or no. And so coming with that information and your level of understanding and what you now know about the endocannabinoid system and the entourage effect and the routes of administration that can help with the condition or the goal that you have going on, and being able to present it in that way can definitely be received a lot differently. Hi, this is Ask Me Anything with Cannability Consulting. How are you today?
I'm doing fantastic. How are you?
Good. Thanks for calling. What can we answer for you?
So I just have a few questions. I've been dealing with insomnia since I was 13. Is there any particular thing that I should be taking in order to help with getting just a good night's sleep?
So cannabis can definitely help with a good night's sleep, and it wouldn't be fair to make a recommendation just based off of the little bit you just told me, but just speaking in general terms, the way that cannabinoids like THC or CBD work in our body really depend on the amount that we take and the time in which we take it. So too much or too little, either CBD or THC, could even make you be more awake. So I've had folks say, I've tried to use CBD for sleep and it didn't help. Well, at low concentration, CBD can actually increase your wakefulness and make it harder to fall asleep. Whereas THC can promote sleep and reduce the time it takes to fall asleep. But if we're not careful about the quantity and the timing, could cause some morning drowsiness or even anxiety. So it's a very individualized answer as to what ratio or what product might work for you. But there are definitely products and formulations out there designed just for sleep.
Okay. So I've gone through a spell before in which actually smoking it makes my anxiety go up even higher. I smoked for about a year and a half. But I have found that this new trend with pens, it seems to be a lot more gentle. Is there a reason, sometimes smoking actual flower causes more anxiety than, say, a concentrate pen?
Yeah, so a lot can go into that. I'd say the first would be the amount of THC compared to the amount of CBD and the ratio between the two of those things. And also depending on the terpene concentration, the flower may have been, higher in things that promote energy or, promote focus, which if you already have underlying anxiety could have heightened that. And then also just the way the different types absorb within your body, whether it was smoking versus vaporizing.
Which would you say is the fastest growing market? Would you say it's edibles, concentrates, or just flower?
The best in the market. Sorry, you broke up.
Fastest growing.
Oh, fastest growing in the market. I would definitely say edibles would be the fastest growing in the market. There are gummies, cookies, candies, infusions into food. So I feel like as far as variety and things like that go, the edible route has the most, I think, opportunity.
Okay, awesome.
Well, thank you for calling, and I hope sweet dreams to you.
Thank you so much. I appreciate y'all. You have a great day.
Thanks.
Thank you. Take care.
That was a great call about sleeping. And, this has been an issue forever. Like, when did we start hearing how people are having problems sleeping? Queen Victoria had problems sleeping, and her physician did what? What did her physician do?
Recommended cannabis.
That's right. Didn't do a foot rub.
Or Ambien or
any of those
anything
other
like
drugs.
that. Yes. He knew what was going on centuries ago.
That's right. And it's been working. And here we are today having the same discussion. Like, how do we move forward on making sure that people have the right information so that people can sleep better? Because it affects your whole entire life. It does. It affects your wellness. It affects how you feel about yourself, your energy level, your work performance, your relationships. It's at the core of what we can do to make a difference with people's lives if we could just tackle how cannabis can help with sleep.
Yes, we cannabis. I
Yes,
feel like those
we
are really
can.
good political ads, perfect for this time of year. Yes, the potentials are there, and that's just one of many.
Don't lose sleep over it. Contact Cannabilityconsulting.com. We can help you.
Love it. Yes. So info@cannability.com, 757-77-CANNA is our phone number, or you can reach out to us on social media or our website.
And we'll see you next time.
We hope you enjoyed this episode of the Westminster Canterbury Tales podcast. Thank you for listening.